This is In the Loop. I'm Christian Bryant. Across the nation, students have vastly different experiences learning about a somewhat taboo but super important health topic. We're talking about sexual health education, or sex ed. In the US, according to Sex Ed for Social Change, or SECUS, as of July of this year, 29 states and DC mandate sex ed, but 17 of those states require that abstinence be stressed, and only 11 of them require the curriculum to be medically accurate. Yeah, you heard that right. Some states choose to leave discussions around healthy relationships, contraception, and sexual orientation out of the conversation entirely. Now, that's a lot to dive into, but seeing as September is Sexual Health Awareness Month, now's not a bad time to talk about it. To get a better understanding of what this looks like across the country, we sat down with SECUS.
Due to the lack of guidance and policy implementation at the federal level, the United States has a patchwork of laws that vary, which determine what and if sex education is being taught. When it comes to education, policy decisions have largely been left to local control. So we're talking very local at the school board level, right? Not even the city or state level. It's very, very local.
Currently, at the federal level, SECUS is one group working to get the Real Education and Access for Healthy Youth Act passed. This act promotes comprehensive sex ed, which means giving young people the knowledge and skills they need to make healthy choices about their sexual lives, and the act makes sure access to this education is protected. In March, Congress passed the Consolidated Appropriations Act of 2022, but funding for comprehensive sex ed programs is not included. And on the state level, according to the SECUS mid-year report, the number of bills introduced this year aimed at restricting sex ed was almost equal to the number of bills introduced advancing sex ed. But more regressive bills were passed in states this legislative session than progressive ones.
So I think there is this big myth that if we teach young people about sex, that they're going to go and have it. The evidence does not show that. Additionally, I think it is very important for us to understand that age-appropriate or developmentally appropriate sex education is key.
A Georgetown University study shows that sex ed helps with a lot of things, like preventing unplanned pregnancy, maternal death, unsafe abortions, and sexually transmitted diseases. But a survey from the Public Religion Institute found that nearly a quarter of millennials were not taught sex ed in middle or high school. There's also a big gap in sex ed that's inclusive and talks about LGBTQ+ identities. Less than 10% of LGBTQ+ students say their school's sex ed is inclusive. When talking about gender identity and orientation, this is sometimes where curriculum can become medically inaccurate.
Medically accurate sex education is vital to promoting long-term health outcomes.
Florida in particular has become a bit of a hotspot when it comes to sex ed and what can or should be taught. Katie LaGrone, a correspondent at our sister station in Tampa, joins us. Katie, what does the state of sex ed in Florida look like right now?
Hey Christian, as you know, Florida continues to make national headlines on new laws governing what can and cannot be taught in classrooms across the state. Among the most notable new laws, what critics have dubbed Florida's Don't Say Gay bill, which limits discussion on sexuality and gender identity in some Florida classrooms. It got us wondering how those new laws are impacting old policies governing sex education here. And what we discovered is across the state, school districts have adopted a confusing mix of standards, which ultimately leaves thousands of Florida students in the dark on sex ed. In Florida, while laws mandate health education include teen dating and disease control, we discovered there's actually no statewide curriculum for sex education. So what and how students are taught about sexual and reproductive health is left to individual school boards who approve policies, principals who interpret them, and instructors who ultimately drill it all down for students. What's more, we found about a third of Florida's 67 school districts are teaching students, even high schoolers, abstinence only.
So what, condoms and birth control are not even discussed in the most basic way?
Correct. And I'm as surprised as you. That's really unfortunate because whether kids are sexually active in high school or as an adult, they still need that information to make healthy decisions to protect themselves.
And studies show abstinence-only instruction does not prevent teens from having sex. In fact, a 2019 study by the CDC found by 12th grade, more than half of Florida teens surveyed had already engaged in sexual intercourse. So why are these districts limiting what they teach? Well, one district spokesperson tells me they are respectful of parents' rights.
All right, many thanks, Katie, for that reporting. So the US isn't doing all that great with their sex ed curriculums, but are there other places where we could learn a thing or two? Around the world, some countries have been recognized for comprehensive sex ed programs that help combat these issues, especially in Europe. In the Netherlands, it's required by law that all primary school students are taught sex ed. It starts as early as 4 years old, but we should note, they're not talking about the birds and the bees at that age. They are simply covering the basics of healthy relationships. In the US, some people argue that that is too young to be teaching sex ed, but 3 decades of research shows that sex ed can help prevent child abuse. On average, teens in the Netherlands are also waiting longer to have sex when compared to the rest of Europe or the US. Researchers found that most young people in the Netherlands had wanted and fun first sexual experiences, while many American teens said they wish they had waited longer to have sex for the first time. The Netherlands has one of the lowest teen pregnancy rates in the world. Dutch teens are some of the most likely to use birth control pills, though part of that could be because contraception is easily accessible. The Netherlands also works to educate parents on how to talk to their kids about sex to help get everyone on the same page. In Denmark, for a long time, their sex ed program emphasized preventing unplanned pregnancy and promoting safe sex. In 2015, the country's birth rate fell below the rate necessary to maintain population, and Danish officials went as far as actually encouraging people to have babies at a younger age. At the time, only 0.5% of teen girls in Denmark had a baby. That rate was 6 times higher in the United States. In recent years, the birth rate has started to rise again. While Denmark or no country has a perfect system, they experienced some outcomes that other places could learn from. So there are good models for comprehensive sex ed, but there are also other countries like the US where it isn't taught widely, there are inconsistencies, or it's not available at all. Experts stress the importance of making sure students have the information necessary to live healthy lives.
We really need to push for something that is rooted in age-appropriate, medically accurate, and affirming content that is taught by trained educators to be able to deliver the most comprehensive and age-appropriate education around sexuality as possible.